24 healthcare organizations and groups have sent a letter to Governor Eric Holcomb. They are asking him to prioritize a cigarette tax increase this year. WRTV's Stephanie Wade explains how the extra money could improve the health of all Hoosiers while encouraging smokers to kick the habit.
We've been pushing for this for a while, in part because Indiana's health metrics are so bad across the board.
Whether it's obesity, infant mortality, diabetes.
So many things are linked back to Indiana's high smoking rate.
And that's why more than 200 healthcare, business, and youth organizations have backed this effort, signing a letter asking Governor Holcomb and lawmakers to increase the cigarette tax by $2 per pack.
Who are also on the front lines of the COVID-19 pandemic.
If somebody smokes, then they are more likely to have heart disease, or they're more likely to have lung disease. And then if they get COVID on top of that, that is just devastating for them. So our population in Indiana is starting at an unhealthier baseline.
Brian Hannon with the American Cancer Society Cancer Action Network says about 1 in 5 adult Hoosiers smoke, which is one of the highest smoking rates in the country.
The public support is there. About 70% of Hoosier voters support an increase in the cigarette tax.
Equally as troubling, it's about the same rate for youth who smoke.
Raising the cigarette tax is not only a cessation effort to help current adult smokers quit, but it also raises that barrier of entry for youth who are very price sensitive, but also very impressionable.
We know a tax increase would do that. So there's actually really good evidence that a 20% increase in a tobacco tax would decrease the number of kids who start smoking by double digits.
The more unhealthy our state is, pediatric doctor Emily Scott says, has an impact on all of us in terms of our health care costs.
Indiana's cigarette tax rate is below the national average. It's been 14 years since we've last raised the cigarette tax. In that time frame, over the last 14 years, states and local governments have raised the cigarette tax dozens of times.
If we generate more revenue through this tax increase, advocates say we can use that money elsewhere, as Indiana ranks 48th in the country for the amount of money we dedicate to public health funding.
We need to make our state healthier. We cannot continue to be at the absolute bottom of our nation in terms of health rankings.
Stephanie Wade, WRTV.
The current Indiana cigarette tax rate is about 99 cents per pack. The proposal would increase the rate to $3 per pack. That would be just 2 cents higher than Illinois' $2.98 per pack cigarette tax.